Okay, hello and welcome, members of the Chinese Medicine Practitioner Meetup Group, hosted by Kamwo. My name is Thomas Leon. I'm the organizer of this group and your host for this afternoon or evening, depending on where you are. I want to take a moment to welcome all new members to our group. I hope you will enjoy what we have lined up tonight, and hopefully this is the first of many events to come. The mission of our meetup group is to connect members with respected authorities on subject matters within our profession and to create a space where members of our community can come together and learn from each other. The events are always free and our speaker suggestions come from you, the members. So if you have suggestions for speakers, please send them to us. By attending tonight, each of you will receive a $20 coupon via email. So please look for the email that will be coming in the next couple of days. If you don't see it, look in your spam box. Here are some ground rules. Please mute your microphones, but please feel free, and I would even encourage you to leave the camera on. Past event surveys indicate that it's a moral boost to see other faces when a community, when we're sharing the same space. I guess COVID does that to people, and we need to have that connection. So please hold off on questions until our guest speaker give us the cue to do so, to ask. And of course, there will be a Q&A session toward the end. However, if it's something that's urgent and relevant, please type your comment on the chat box and raise your hand, and I, as the host, will address this issue. Tonight's event is co-sponsored with acupuncturists of Facebook. They're currently the largest acupuncturist group with 13,500 members. So for those who are joining us from acupuncturists and Facebook group, welcome. Okay, we welcome you to the group. Tonight's lecture will take about an hour, and then we have the last 30 minutes for Q&A. So we should be wrapping things up around 7:30, a little bit after. Okay, so just want to let you guys know you plan ahead. Now, without further ado, let me introduce tonight's speaker, Dr. John Chen. I've known Dr. Chen for many years now, and for full disclosure, our companies have professional dealings over the years. However, this is in no way the reason why he is here tonight. John is one of the most prolific advocates and scholars of our profession. I've been a big fan of his work over the decades. As a fellow Western pharmacist who works in the TCM profession, I feel a special kinship with him and especially proud whenever John does something amazing. So, I take a little credit with fellow pharmacists. I'll give you an example. During the beginning of the COVID-19 shutdown, John translated some of the TCM hospital formulas that so many of us have used during that time. So that's, I thought it was very great that he did that for the profession. Okay, so let me just read John's bio. Dr. John Chen is a recognized authority in both Western pharmacology and Chinese herbal medicine, having combined formal training in both fields with extensive research ground in China. He teaches at USC School of Pharmacy, Empress College, Yosan University of TCM, OCOM, 5 branches, AOMA, and also ACTCM, and has taught many professional seminars across the US and internationally. Dr. Chen's published works include Chinese medical herbology and pharmacology, Chinese herbal formulas and applications, and Chinese herbal formulas for veterinarians, for which he worked as the lead author. So on behalf of our group, thank you. We welcome you to tonight's event. So how do we do it online? We do this, right? Like a applause for Chen. So welcome. Thank you. I'm handing it over to you.
All right. Thank you, Thomas. And hi to everyone, wherever you are. I think it has been a crazy couple of years with COVID. Our life pretty much changed completely. And the way we learn, the way we teach, and the way we treat patients have all been quite different. But fortunately, I think we are at a point where life is just about back to normal. Oh, by the way, Thomas, if you could you let all the attendee in automatically so the chime doesn't just happen every couple minutes?
Oh, I tried to look for that function.
Okay. Well, anyways, as you do that, I'll just continue.
Okay.
So anyhow, so over the last 2 years or so, my colleague and I have done a lot of work in terms of research on COVID. We try to find as much information as we can in the Chinese language. We translate them and we publish all this information either via handout, translation, webinar, and so on. So I'm not sure how many of you have gone through or seen those information, but if you were to go to the eLotus website, let me just, okay. So these are some of the examples of things we have done. I did one class on the traditional aspect of how TCM treats infection or wind cold, wind heat type of things. And then the second one was specifically on COVID-19. So the topic was how coronavirus, COVID-19, is treated with TCM in China. And this information, by the way, is available as video, available in handouts. Also, we, during this time, have many colleagues in different countries that also translate this into different language. So in this case, there's also information in German. So this was specifically on how TCM treats COVID-19 in China. And then we went one step further and I found a lot of information about clinical research. Okay, so this is both from a formula perspective and also from a single herb perspective in which different herbs and different formulas are used to treat many different aspects of COVID-19. Some are to treat the virus itself, some are to treat the different signs and symptoms or complications, and some are to treat long COVID. So once again, all this information is available both as webinar on video and also as handout as well. And same thing for today's lecture. So in a way, the topic of today's talk is COVID-19, past, present, and future. So this is not quite in the past yet, but I think in the Western world, we are near the tail end. So if you look at this from a bigger perspective, I think in a way you can think of past as in how TCM would use its theories and its methodologies to treat COVID-19 in the past. And obviously this has to do with two main theories. One is Sanghan, which is cold-induced disorder. And the other one is Wenbing, which is warm diseases. All right, and both of them have significant lessons that we can learn from. Okay, so while one is not perfect, one is not better than the other, there are times you need to draw lessons from both schools of thought and use herbs and use formulas to get the best effect in terms of treating the patients. Okay, present, I would say is, and this is what I do on a regular basis, and that is trying to combine Western medicine with Chinese medicine. Because on a clinical level, if you are communicating with nurses, MDs, pharmacists, or even patients, for me, using the terms of yin and yang can only get you so far. Okay, so you do need to use language that your peers can understand. But at the same time, when you start to dig into the pharmacology of herb, one of the things that you'll realize is that not all heat clearing herbs are the same, right? So you may think of infection as a heat condition in Chinese medicine, right? Whether it's wind heat or lung heat. But what happened is not all the heat clearing herb have the same pharmacological effect. Some are great as antipyretics to treat fever. Some are good as antibacterials to treat bacterial infections. Some are antiviral to treat virus. Some are anti-cancer and so on. And even if you were to narrow down the herb, heat clearing herb to antiviral, they are different herbs that treat different virus. And then even within the coronavirus, there are different herbs and different compounds that treat different aspects of coronavirus. Some block the spike protein, so the coronavirus cannot enter the lung cells. Some block different enzymes, so the coronavirus cannot replicate. Some block the release of the virus from the lung cell into the airways. Okay, so there are many things we can learn if we would open ourselves to Western medicine and all the research. Okay, and I think it's quite amazing that many of the herbs that we have used for thousands of years, in fact, have very strong effect to treat different aspects of the viral disease. So for me, I find it fascinating, and also at the same time, knowing these pharmacological effects of the single herb and also clinical research of the formulas, I think will definitely help to narrow down and also make the formula more precise in terms of exactly what you're trying to do to treat the patients. All right, so I think that's what's going on present day. There is a lot of research going on. And in terms of the near future, okay, even though I think most of us by this time know how to treat COVID fairly well, okay, but one thing that may still be a bit challenging is the patient that come and they have the long COVID condition, or if you are treating the vaccine toxicities. Okay, so these are the things that may linger for a while. Okay, the long COVID may linger from days or weeks up to a year. And COVID vaccine toxicity, even though it doesn't happen in a large number of patients, but when it does happen, could be quite significant. All right. I won't have time to go into the last topic, but I'll at least touch upon it a little bit toward the end. All right. So for today, most of our focus will be on how to treat long COVID. All right. And what happened is in Western medicine, in the beginning, they really did deny the presence of long COVID. All right. Because in Western medicine, in most cases, they test for virus, they treat the virus, and once the virus is gone, once the test is negative, in most cases, the doctor send the patient home and you're clear, you are able to resume most activities. And that is the case if you go to college, if you go to high school, if you board the plane, once you can show the negative test, you are basically clear. But what happened is, even though the medical doctors or establishment may consider you to be clear, what happened is patients suffer from long COVID. They suffer from a lot of signs and symptoms that the Western medicine just don't recognize for the longest time. And in fact, it's kind of a patient-driven movement that catches the Western medicine's attention. And then they turn around and start to pay more attention to it. All right. So these are some of the most common signs and symptoms. On your left, with the darker lines, those are the signs and symptoms that are present during acute COVID. And on the right side, in the lighter gray, is the signs and symptoms that are present in long COVID. So there's a lot of overlap, but the severity and the percentage may not be exactly the same. So if you see here, some of the most common signs and symptoms of long COVID include fatigue, dyspnea, joint pain, chest pain, cough, anosmia, and so on and so forth. Okay, so quite a few different signs and symptoms affecting quite a few different organ systems in the body. Okay, so Western medicine at this time is still struggling a bit on how to best do this because when they can identify the virus, they know how to treat it. But when there's no virus anymore, it's hard for them to know what to do. Okay, so at this moment in time, they're still struggling, and that makes it a advantage for TCM. And the reason I say that is because in cases like this, Chinese medicine can establish or determine the pattern of imbalance in the body. Okay, so this is where Chinese medicine, I think, is significantly better than Western medicine in terms of repairing the body, restore the normal health. Okay, so
John, I'm sorry to interrupt you. I just got a bunch of comments. They're asking, like, does the slideshow start yet, or we just still doing?
Wait, is the slide continue? I'm moving the slide as I go. Is the audience seeing that as well?
No, not at all. I'm sorry, because they were trying to, because I thought you were just, now the slideshow's not moving.
No, I've been moving the slide and I've been sharing. So I thought everybody would be able to see it.
No, maybe hit resume.
Okay, so let me stop sharing and resume sharing and see how that works.
Thank you, everyone, for pointing that out.
Okay, so this is a slide of a person with coronavirus. Okay, and I'm going to move to the next slide.
All right. Perfect.
Okay.
Now we can see it. Okay, good. Thank
Oh,
you.
good. Oh, sorry about that. Yeah, we should have
That was
rehearsed
my
a little
fault. I
bit
should
in
have
the
spoke
beginning.
up earlier. I think
Oh,
I.
no, it's okay. It's okay. Okay, so in any case, I think the important information is just starting, so we caught that little glitch at the right time. So what I was saying is that with patients that have acute COVID, what happened is most of the virus enter the body through the lung and sometimes through the GI system. But what happened is they don't stay there. In fact, they can move on to different organs in the body. Okay, so those that have severe COVID, what happened is lung and GI may be the place where the infection starts, but the virus may move to different parts of the body and attack different parts of the body. So what happened is eventually when the virus are killed, are no longer present, right? So now the test is negative. What happened is you have a lot of damages to different organs and different systems throughout the body, okay? And that is why when patients come in with long COVID, you see them with all kinds of different signs and symptoms. It's not necessarily just the lung or necessarily just the GI, but rather it could be blood clots, it could be heart, it could be your endocrine system, it could be your brain, nervous system, and so on. All right, so keep that in mind that long COVID signs and symptoms can be quite wide and quite broad and affect many, many different systems in the body. Okay, so what we'll do is we'll go through the common signs and symptoms, how they affect these different systems in the body, and also what we can do with TCM to treat these different organ and system injuries. All right, I think this first one is a good article to start with. Obviously I put all this on the handout, and also there's a link at the bottom when you do get the handouts. But in any case, you can get this online, and this is a good one to summarize the entire COVID-19 and TCM. The title here is Therapeutic Options of TCM for Organ Injuries Associated with COVID-19 and the Underlying Mechanism. Okay, so as you get into it, the article basically talks about the pathophysiology of COVID-19 and the long COVID, and it breaks it down to three main things. Okay, so if you understand these three main principles, it goes a long way toward knowing what you need to do with TCM to treat the disease, to treat the complications, and also to treat the sequelae, right? So the first is the direct cytotoxic effect of the infection. All right, so this here is referring to the coronavirus going into the body. They will then enter the lung cells, they will grow, they will multiply, and eventually it will cause a lung cell to burst. Okay, so basically it kills the lung cell, but more importantly, this is now going from one virus to hundreds or thousands of viruses that can then move on to affect other lung cells, maybe other parts of the organs of the body, or if the patient exhales or coughs, now the virus goes to other patients. All right, so in order to treat the acute COVID-19, we need to use herbs that have a direct cytotoxic or direct effect to kill the virus. Okay, so these are generally speaking the heat-clearing herbs, but more specifically the heat-clearing herbs that have antiviral effect and specifically against coronavirus. Okay, otherwise you may have some herbs that are heat-clearing herbs that treat fever, or some herbs that are antiviral herbs, but maybe against HIV or against herpes, right? So it's not enough to know that it's a heat-clearing herb or antiviral herb. Ideally, it's a specific antiviral herb against coronavirus, all right? Next, what we need to know is that when the virus is in the body, obviously it's gonna stimulate the immune system, and the immune system in turn will come and try to kill the virus as much as possible. So basically the virus will stimulate the immune reaction. It will trigger the inflammatory process to kill the virus. And if everything works as it should, then there should be little damage. But what happens is sometimes the body over-responds. Sometimes the body ends up producing too much cytokine. So this may then lead to cytokine storm, which is excess heat and fire, and also dysregulation of the immune system. This is something that may occur while the patient have the acute COVID. It can also be something that lingers once the virus is gone, there is viral fragments that are left in the body, or the immune system becomes somewhat dysregulated on a long-term basis. And that then becomes the beginning of the autoimmune disease. All right. So just because the virus is gone, the infection is gone, doesn't mean the patient is completely healed. Okay. So inflammation and dysregulation of the immune system is very, very important, both during the infection and also on a long-term basis. All right. And then what happens is when the inflammation is severe, what happens is it may cause damage to multiple systems and multiple organs. So if the infection is mostly in the lung, then the lung may suffer. If the virus has moved beyond the lung to the heart or the intestines or the stomach or the kidney or the liver, then what happens is those organs may also suffer. All right. So in Western medicine, it's the inflammation causing the apoptosis, which is the injury and death of the cells and tissues. And from a Chinese medicine perspective, inflammation is a heat. And when you have heat for a prolonged period of time, then the heat can cause qi damage, and heat can dry up the yin and the body fluids. All right, so damage to the qi refers to damage of the function, and damage to the tissue and organs refers to the insufficiency, and so on. All right, so basically that's both a short-term and also long-term damage associated with COVID-19. All right, so once again, when you're looking at acute COVID, you have to look at the direct cytotoxic effect of the virus and also the inflammation. When you are looking at the long COVID, you have to also look at the inflammation, but in this case, it's probably slowly trending toward deficiency heat. So it's a chronic inflammation, not the acute inflammation, which is a excess heat and fire. All right. And then finally, the apoptosis and injury of the organs and tissues. And that in the long run is going to be insufficiency with deficiency heat. All right. So this can be treated with herbs. It can be treated with acupuncture, martial exercise, and so on. So we'll focus mostly on 2 and 3 for the rest of this 1 hour. All right. Going back real quick, we talked about, well, I show over here that if you need to treat a disease, if you need to cure the virus, these are some examples of heat-clearing herbs that have direct antiviral effect against coronavirus. All right, so if you need to pick, let's say if you're writing your own personal formula for the patient, these are some of the herbs that will be important or good to add if you know that the patient has COVID-19 and you want to use some herbs that have antiviral effect against coronavirus. And obviously, a lot of these herbs we're already familiar with, right? So you have Jin Yin Hua and Lian Qiao, Lanisora and Forsythia. So for example, whether you write your own formula or you use the classic formula in Qiao side, basically you'll get the same effect, okay? You can also use the pair of Ban Lan Gen and Da Qing Ye, which is Isatus root and also Isatus leaf. You can use Guang Huo Xiang, which is pogo stemon. And once again, you can use the classic formula Huo Xiang Zheng Qi Shan, and that will be effective to treat coronavirus affecting the digestive tract. Okay. Then you have Huang Lian and Huang Qin, Cactus and Scutellaria. So up till now, most of these herbs are fairly standard. These are heat-clearing herbs that have antiviral effect in this case. And then there are some that are that you probably wouldn't know otherwise unless you dive into the pharmacology of the herbs. So one of them is Xiang Chun Ye, which is Tuna chinensis. One of them is Wu Bei Zi, which is astringent herb, Gala chinensis. And the other one is Yu Xing Cao. Okay, so I try to give you a nice balance of herbs that are fairly obvious, but also some that are not so obvious. Okay, so depending on the exact sign and symptom of the patient and your TCM diagnosis, you can pick and choose what you think is most appropriate. And then if the patient shows a lot of inflammation, all right, so these are also heat-clearing herbs that help to reduce inflammation, but not necessarily with antiviral effect. All right, so what that means is this is not the same as inflammation that are associated with acute pain, acute injury, but rather these are the inflammatory factors that are triggered when you have certain allergens or chemicals or toxins in the body, or even virus that trigger the deeper anti-inflammatory effect. And when these inflammatory effect goes out of whack or becomes hyper, then that's the beginning of possibly autoimmune disease. So these are the herbs that clear heat on a deeper level that have anti-inflammatory effect. Examples include 大黄, rhubarb, 黄芩, scutellaria, 广藿香, pothos lemon, 丹参, salvia, and also 石膏. So once again, the list is obviously a lot longer than this, but once again, I try to give you some herbs that are fairly obvious. Okay, so 黄芩, 大黄 will be fairly obvious. And 丹参 is a blood-moving herb, but also has good anti-inflammatory effect. So that may not be so obvious. So once again, if you are putting together your custom formula, those are many options you have. And then lastly, these are herbs with anti-apoptotic effect. Okay, so apoptosis means the death of cells or death of organs. Okay, so these are toward the later stage of infection. As chronic inflammation or as all immune system becomes hyperactive, as they start to eat away the organs and the tissues. Okay, so when the organs and tissues are being damaged, basically in TCM, that means the patient is showing insufficiency. So in other words, these are herbs that nourish in, that help to restore the normal form of the organs. Okay, so most of these are going to be in tonic herb. But once again, there are some exceptions. So once again, hopefully this is a nice blend of herbs that are obvious and herbs that you didn't know before. So once again, we have 枸杞子, lycium, 红景天, rhodiola, 黄芪, astragalus, 厚朴, magnolia, and so on. All right, so these are herbs, I think if you are treating long COVID, something that you must consider using, as they will help to restore the form. And once the form of the organ is restored, then the function will come back. Okay, so the function is qi. And that's why when you're treating long COVID, you need to tonify in and tonify qi and nourish in. So in is the form and qi is the function. They basically go hand in hand. All right, so let's go through some of the more generic approach. And by generic, I mean these are things that are published by various hospitals or provincial protocols or national protocols. Okay, so I touched up on this already in 2 of my earlier presentation. So if you want to know the more details, you're more than welcome to go and click on and watch those webinars. So for here, I won't spend too much time. So these are 3 protocols that I touched on earlier. Basically in the recovery phase, most of the patient will show deficiency of qi and yin, and the 2 main organs that are affected are the lung and spleen. And of course, this is the case because coronavirus primarily enter and affect the lung and also to some extent the gastrointestinal system. So lung and spleen, qi and yin are the main organ that are damaged. So when you are treating the disease, especially during the recovery phase, you need to tonify qi and nourish in these 2 organs. So for the Hubei provincial protocol, their standard formula to use is 沙参麦冬汤, Glenea, and Ophiopogonus decoction. And this is the composition of the formula. So primarily the first 2 herbs you can see is 沙参 and 麦门冬. These are the 2 key herbs that represent the formula and primarily also tonify qi and nourish in. Okay, and this is one of the first hospitals that start to see a lot of COVID-19 patients in Wuhan. And once again, their conclusion is pretty much the same, that lung and spleen are the 2 organs that are primarily affected, and qi and yin are the 2 things that must be rectified first. Okay, they came up with their custom formula, but this formula is very much similar, if not very much similar in terms of core herbs as 沙参麦冬汤. And as you can see, the first 2 herbs gives you the exact same representation. So you have 沙参 and also 麦门冬 as the 2 main herbs. Once again, to tonify qi and nourish in. All right. And then this book here is the Guidance of Coronavirus Disease 2019, and this is their national protocol. And in this case, once again, the conclusion is the same, to treat lung and spleen and to tonify qi and nourish in. So these are the signs and symptoms, which is the same. as what most of the patients show when they have COVID-19. And this is a formula primarily for deficiency of the lung and spleen. So this is a modified formula. And then if the patient primarily have deficiency of the qi and yin, this is the formula that they recommend. Okay, so in China, in this case, what happened is they do pre-make these formulas. So if the patients come in a big wave, then they have the formula ready. Obviously, if you have more time, you can custom write the formula based on specifically what the patient shows, signs and symptom wise, and also the variation in TCM diagnosis. All right, so this is what I referred to earlier as the more general approach. Okay, so these are protocols taken from hospital, provincial, or national perspective that you can follow as a general guideline. Okay, but like I mentioned, not all patients show just lung and spleen, stomach signs and symptoms. There are many other organs and many other systems can be damaged. All right, so now we'll take some time to go through all these smaller boxes on the side to see what are some of the options as far as formulas and as to how to treat them. All right, so the first one here is the more severe case of lung damage. Okay, so in the early stage, you may have some mild damage to the lung, so the patient may have cough, wheezing, dyspnea, and so on. But if the disease continues, then what happens is you will get more severe, and eventually you'll end up with pulmonary fibrosis. Okay, so that's the Western diagnosis. The Chinese diagnosis for pulmonary fibrosis is that there is damp and phlegm accumulation as well as blood stasis. All right, so what happens is, as lung is usually an organ that is very flexible. So as you breathe in and out, your lung expands and shrinks, expands and shrinks. But what happens is when the lung dies, okay, it's no longer flexible. The tissues become fibrous. All right, so it's very hard, it's very firm. It doesn't expand anymore. So the lung loses its function. All right, so basically when you see that, that is damp and phlegm as well as blood stasis. Okay, so that was the first article. This is just another article that also look at pulmonary fibrosis from a TCM perspective. And in both cases, they came to the same conclusion. All right, so there are a lot of formula that have been tried, but the one they both agreed on to be the best formula is one with a red arrow here, which is 血府逐鱼汤. And 血府逐鱼汤 literally means to drive out the blood stasis in the mention of the blood. So basically, to treat blood stasis in the upper jaw. Okay, so historically, this is mainly used for two main things. One is cardiovascular disease, and the other one is pulmonary disease. So for cardiovascular disease, obviously, this is for angina, for coronary artery disease, for basically heart attack. All right, and for pulmonary disease, it could be one or two things. One is actual blood clot in the lung, so pulmonary embolism, or another would be pulmonary fibrosis. Okay, so in this case, most of the herbs are to open up the blood circulation to the lung, to break up the blood stasis, and basically help the body to heal itself. Okay, and this is a comparison and contrast of what the TCM function is, as well as all the signs and symptoms, and all the Western disease name that it's able to treat. Okay, so as you can see, there's a lot of overlap. And also from a Western perspective, it's not just for blood clot or blood stasis in the heart and lung, but also for many different parts of the body. And the reason is because once you have a blood clot and it's circulating in your blood circulation, it doesn't just stay in one part. The blood clot can travel to different parts of the body. And at the same time, the herbs are doing the same thing. Herbs don't just go to the lung and the heart and stay there, but rather they do go to different parts of the body. Okay, so while the formula is best for the upper jaw, the effect is not limited to only there. All right. So in the end, what happened, like you mentioned, is this is a great formula to activate blood circulation and dispel blood stasis. And from a Western perspective, this formula definitely has antiplatelet, anticoagulant, and also cardiovascular effect, basically to improve the blood circulation. All right. Another formula is one called 益气宣必汤. Okay, so this formula is published in Chinese. Okay, Unfortunately, the English version is only available in abstract, not the entire article. Nonetheless, it talks about how to treat pulmonary fibrosis. And once again, the article emphasizes that the TCM diagnosis is primarily phlegm accumulation and blood stasis, as well as underlying spleen and lung deficiency, as well as Qi and Yin deficiency. Okay, so it's not just treating the symptom, but also looking at the underlying deficiency from a TCM paradigm. And this is the composition of the formula. Interestingly, the article lists all the herbs, but only the dosage for Huangqi, okay, and not the rest of the formula. And if you look at here, the dose of Huangqi is quite high. Generally speaking, when you're using Huangqi to tonify Wei Qi, it's probably around 9 to 12 grams, but in this case, it's 30 to 60 grams. Okay, so it's quite high. And there's a very specific reason why it's doing that. Okay, so I won't tell you just yet, but I'll get to it at the end of the class. All right, but overall, this is a formula that also seems to be quite useful for treating pulmonary fibrosis. That on one hand has an excess pattern, which is dampen or phlegm accumulation and blood stasis, but at the same time have underlying deficiency. So lung deficiency, spleen deficiency, and also Qi and Yin deficiency. Okay, so another formula you can consider using for patients with pulmonary fibrosis. And then the modification is, if they have lung and spleen Qi deficiency, these are some herbs you can add. Okay, Guang, Huo, Xiang, Yi, and so on. If they have Qi and Yin deficiency and Yin deficiency He, then these are some of the herbs you can add. Herbs that nourish Qi and Yin and clear deficiency He, like Sa Shen, Mai Dong, Zhimu, and so on. Okay. One thing I was going to point out real quick is in the first one here, you have Pei Lan, which is eupatorium. Okay, just so you know, eupatorium contains pyrrolidazine alkaloid, which is potentially a toxin to the liver. Okay, so in most cases, that's not going to be an issue, but in patients with pre-existing liver condition, then don't use this herb. Okay, so that is the first part with the lung. And then the second part is going to be with the heart. While the patient has COVID-19, generally the issue is going to be myocarditis. But as they recover from COVID-19 and now they have long COVID, generally speaking, in most cases, they're going to have heart deficiency. All right. So this is an article that talks about how to treat COVID-19 with many different aspects of TCM, but it also mentions specifically about heart deficiency. And in this case, it's the heart and lung Qi deficiency. And the formula that it recommends is a classic formula called Sheng Mai San. And Sheng Mai San is a very simple formula with only 3 ingredients. And they are Rensheng, Mai Men Dong, and Wu Wei Zi. So Rensheng is primarily a Qi tonic. Mai Men Dong is primarily a Yin tonic. So it follows the same pattern that we have talked about so far, that in most patients with long COVID, you really need to treat the Qi and Yin deficiency. And then Wu Wei Zi is an astringent herb, helps to reserve the Qi, so the body doesn't lose too much Qi in the meantime. Okay, so this formula does work and will work very well. And I will only say that the main caution is make sure the patient does not have heat in the body, because Rensheng is a warm herb and will add to the heat. Or if you look at it from a Western perspective, heat in this case may mean that the patient still has infection, or maybe the patient still has inflammation, or maybe the patient is at risk of long COVID in the form of autoimmune. So in any of those cases, Rensheng, if it stimulates the immune system too much, then it may cause the inflammation to flare up. Or if the patient in fact has autoimmune, then you don't want to stimulate the immune system too much, because once again, that can lead to a flare-up and make the disease even harder to control. So you can look at this from either a TCM perspective or Western medicine perspective, and you'll come to the same conclusion in terms of caution and contraindication. All right. So these are the effect of Sheng Mai San from both a TCM perspective and also from a Western medicine perspective. Basically, the patient that have long long illness, and they are trying to recover, and they are trying to repair both the form and the function. So the form, once again, is the yin deficiency, and the function is a qi deficiency. In this case, specifically the heart. And these are the TCN functions of the formula, and also the Western function of the formula: cardioprotective, cardiovascular, and also immune stimulant. All right. A lot of patients may also have damages to the blood vessel, and that in turn then triggers blood clots. Okay, so blood clots then starts to float in different parts of the body, leading to thromboembolism. Okay, so in this case, what we can do is use herbs, or more specifically formulas, that invigorate the blood circulation and treat blood stasis. Okay, so these are 5 of excellent formulas that are very easy to see what they are, what they do, and use in clinical perspective. So the first one is Tong Qiao Huo Xue Tang. Qiao refers to the sensory orifice. So basically your 5 senses or your head. All right. So if the patient has blood stasis in the head, blood clots in the head, then this would be the ideal formula to use. The second formula is Xue Fu Zhu Yu Tang, drive out blood stasis in the mention of the blood. So this is primarily for the upper jaw. So for heart and for lung, blood clots. Third one is Ge Xia Zhu Yu Tang, drive out blood stasis below the diaphragm. This is for the middle jaw, in the stomach, the liver, area. Then you have Sao Fu Zhu Yu Tang, drive out blood stasis in the lower abdominal area. So this is for the lower abdomen area. Historically used primarily for women, especially if women have fertility problem, have endometriosis, different women's health disorder. And then the last one is Shen Tong Zhu Yu Tang, drive out blood stasis from a painful body decoction. Historically, this is primarily used for blood stasis in the limbs, in the musculoskeletal system. So maybe somebody with sports injury, car accidents, or injury from martial arts. Okay, so if the patient have thromboembolism, blood clotting type of problem, depending on where is the affected area, you can pick and choose any of those formulas accordingly. And earlier we mentioned that TCM and Western medicine have very interesting, very different paradigms, very different description of how they see the same disease. But at the same time, even though the terminologies are very different, sometimes they're exactly the same. And what I mean by that is, this is one of the Chinese medicinal called 水蛭, which is medicinal leech, hirudo. TCM description is that it breaks and eliminates the blood stasis. And in fact, this is one of the strongest herbs for that purpose. But what happened is, one of the main compound in this herb is called lepidolin. And this is a drug, or this is a compound that has been isolated and made into a pharmaceutical. So it can be used in oral form, which is called hirudo. And you can tell from the left side, this is a drug in Japan. In the US, this is an IV drug called Reflutin. Okay, so basically, to me, it's exactly the same thing. Okay, if you use it in its original herb form, then we call it an herb that breaks the blood stasis. If you use it in drug form, then in Western medicine, it's described as an antiplatelet and anticoagulant, either in the name of hirudo or Reflutin. Okay, so this is usually the example that I use, that even though the terminologies are different, in the end, it's basically the same molecular compound treating the same condition. All right, the next possible complication with long COVID is gastrointestinal. And like the lung, gastrointestinal, the digestive system, is a battleground for both acute COVID and also for long COVID. All right, this is an article that the title is Reflections on the Treatment of COVID-19 with Traditional Chinese Medicine. They talk about many things, starting from observation to mild case to severe case, critical case, and so on. And then eventually the convalescence, which is the recovery phase. So in this case, the standard recommendation recommended by this article is a formula called Senling Bai Su San, ginseng, poria, and atraca lotus powder. Okay, so this is a standard classic formula to treat the spleen and stomach deficiency. So if the patient has COVID-19 and digestive system is damaged, where they have poor appetite, they have malnutrition, they cannot absorb the food and nutrient, and of course that contribute to fatigue, then Senling Bai Su San is the best formula to use. Okay, and obviously this is a warm and hot formula. So if the patient still has heat, if they show any indications of autoimmune, then it's better to modify the formula and take out ginseng, and add in other qi tonic herbs that are less likely to stimulate the immune system excessively. So maybe you can use huangqi astragalus, maybe you can use dangsen, cotonopsis, okay, or things along that line. Okay, so once again, comparison between the TCM descriptions of signs and symptoms and also Western indications. Okay, same thing with terminology. Tonifies the spleen and stomach qi. From Western medicine perspective, it has an effect to normalize the gastrointestinal system and protect the gastrointestinal system. All right. Liver is another organ that's easily or commonly affected with COVID-19 and also long COVID-19. All right. So this article, clinical characteristic and impact of traditional Chinese medicine treatment on the convalescence of COVID-19. And I think this quote here is a good summation of how TCM treats disease as a whole. The mechanism of TCM treatment might be the overall regulation, including balanced immune response, improved hematopoiesis and coagulation system, enhanced function of the liver and heart, increased nutrient intake and lipid metabolism. And my favorite part is the first part, that to balance or to regulate the overall system of the body. Okay, and the reason I say that is because even though Chinese herb, Chinese acupuncture and so on are very helpful to treat many diseases, but what happened is it's really your own body that's able to heal and recover. Okay, so in the end, many of the Chinese herbs, especially the herb that tonify the kidneys, what they do is in the end, they help the body to help itself. Okay, they provide the body with catalysts, they provide the body with some initial push to get the body's healing mechanism going and moving in the right direction. All right, so, and you'll see this as we talk about different formulas and different single herbs. But overall, once again, it's the use of herbs and acupuncture overall to balance the yin and yang, to balance the interior and exterior, and balance the zangfu organs, that in the end will help the body to help itself. All right, so this formula really break up the treatment into three main perspectives. One is to tonify the digestive system. This is similar to the classic TCM theory of 脾胃论, which is a school of spleen and stomach. And basically the theory is that patients that have chronic injuries or chronic illness, the first thing that you need to do is you need to restore the digestive system. Because if you don't, then what happens is you can have the perfect diagnosis, you can have the perfect formula, but if the patient cannot absorb it, then it's just all going to go into waste. All right. So you need to restore the digestive system first before they can then take herbs that treat other parts of their body. So in that case, once again, Senling, Baisu San, ginseng, poria, and the Atraktalotus formula is one that helps to restore the spleen and stomach, so the patient can start this healing process. Another formula that's very helpful is Xiao Cai Hu Tang, minor purpurum decoction. And obviously, this is a formula that specifically is used historically to treat the Xiaoyang syndrome. So Xiaoyang syndrome is describing the in-between stage between the exterior and the interior, between the yang and the yin. So what happened is these are conditions in which the patient have these long, difficult to treat disease that just hangs around and doesn't go away. It's not getting any better, so it's not moving to the exterior, but perhaps it's not also getting worse. So the patient is kind of stuck in this case, in this phase that have some up and downs, but in most cases don't really improve. Okay, so this is another way to look at the Xiaoyang syndrome and how many Western disease, in fact, can fall into the Xiaoyang syndrome. Okay, so this is somewhat of a quite an unbelievable formula that is relatively simple, but is able to treat many different things. And in fact, this is also a core formula to treat both acute COVID and also to treat long COVID. And the reason is because it helps to prevent the acute COVID from moving further in, and it helps the long COVID to go from in between stage and move it outwards. Okay, and like I mentioned, Shaoyang syndrome is an in-between syndrome, and these are many of the Western disease names that all fall under in-between stage. Okay, and it also, in addition to all these different organs, one that is specifically treats the liver and gallbladder. So patients that have hepatitis, that have liver fibrosis and so on, Xiao Cai Hu Tang is in fact a very good formula to use. And in fact, this is the #1 most used formula in Japan. Part of the reason is because the Asian culture, unfortunately, tend to drink a lot, and when Asians drink, it's not quite the same as how the Caucasians drink. Asians tend to drink and they binge drink, and this is part of the culture for college students, and that they never grow out of it. So a lot of business dealings in Asia, what happened is for the business deal to solidify, the business people will tend to drink and drink and drink, and this is how they establish relationships. And in fact, 3 of my uncles died from liver cancer because they drink too much. So this is an issue that I'm very familiar with. Anyhow, in this case, they gave this as a standard formula for patients that have long COVID and that have basically liver heat and fire. Okay, and they show that this formula is in fact quite effective to treat the TCM paradigm of liver heat and fire, but also all the biomarkers from a Western perspective. Okay, so overall, their conclusion is that the present study suggests that TCM, or specifically Xiao Cai Hu Tang, is safe for convalescent COVID-19 patients, and it has protective effect on the liver. All right. Then long COVID patients often will also have renal injury as well. Okay, so renal injury, this is something that can occur in both acute COVID and also with long COVID. Okay, so signs and symptoms can be proteinuria, hematuria, and the labs can be an increase in BUN and also creatinine. BUN is blood urea nitrogen. So items and things that are in the urine that are not supposed to be in there. Okay. This article is quite interesting, and this article, just for your reference, is not done by TCM practitioner, but probably done by statisticians. Okay, so the title is Potential Mechanism of Chinese Herbal Medicine that are implicated in the treatment of COVID-19 and related renal injury. Okay, so basically what they did is these researchers looked through many articles, and they look at the keywords of COVID-19, renal injury, and signs and symptoms. So these are the signs and symptoms, where 59% with proteinuria, 44% with hematuria, 14% with increase in BUN, 10% with increase in serum creatinine, and 29% with acute renal injury. And like I mentioned earlier, what they did is these are statisticians. So what they did was they mined the data, they look at all the prescriptions, in which there are 207 prescriptions, and they look at all the herbs. They are trying to come to the conclusion that what are the herbs that are most frequently used, and determine, well, in that case, then these are the herbs that we should give to all the patients that have kidney damage from acute COVID. Okay, and interestingly, if you look at this list here, these are the most commonly used herbs among the prescriptions that are used for long COVID patients with renal injury. And if this was a trivial question, and I ask you what would be the #1 herb, I think most people would get it wrong. And the answer is in fact Huangqi, astragalus, right? Our traditional understanding of Huangqi is that it's an herb that tonifies qi, or more specifically wei qi. So the question then is, why would this be the #1 herb for treatment of renal injury? Okay, and we'll get to the answer in a bit. And #2 is Fuling, Poria-cocos. So this is a diuretic herb, so that makes perfect sense. #3 herb is Bai Shu. This is an herb that dries the dampness and strengthens the spleen. Okay, that makes perfect sense. #4 is Di Huang Rumania. So this is an herb that tonifies the kidney, so perhaps help to improve the kidney functions and also form. That makes perfect sense. #5 is Sanliao Dioscorea. that also helps nourishing and tonify kidney. So that also makes sense. And then number 6 is salvia, dansen. So these patients perhaps have blood stasis. Okay, and we mentioned also earlier that dansen has anti-inflammatory herb as well. So that also makes sense. So most of the herbs in here in this list make sense. So the biggest question, of course, is why is huangqi used, and why is huangqi the #1 herb used of all the formulas that are used to treat renal injuries? Okay, and once again, if you look at those herbs that we mentioned earlier and break them down into categories, so the #1 category is diuretic, dampness, excreting medicinals. So those are the fuling, zuling, and so on. So once again, that makes perfect sense. Qi reinforcing medicinal. So once again, huangqi astragalus. So once again, that makes no sense. And then others and so on. All right. So let's go back and re-examine the TCM and pharmacological effect of huangqi astragalus. So the TCM function is it tonifies qi, raises yang, tonifies wei qi, promotes the discharge of pus, and generate flesh. And so far, none of them seems to make sense. The last, 4th function is regulates water circulation and reduces edema. So that makes sense. But if we are using huangqi for its 4th function, why would it be the #1 most frequently used herb? All right, so that does not make sense. So I think this last part here, and this is the pharmacology of the herb, is the part that's finally going to shed some light. Okay, and what they have found with the more recent pharmacological study is that huangqi astragalus has many therapeutic functions that we may not be aware of. And #1 is that it reduces renal inflammation by inhibiting interleukin, tumor necrosis factor alpha, and also cyclooxygenase 2. So these are all the pro-inflammatory factors. Okay, so what happened is huangqi at a low dose, as far as we know, stimulates the immune system. So it helps to stimulate and increase the white blood cells, the leukocytes, and macrophages. Okay, but at a large dose, it actually helps to reduce the pro-inflammatory cytokines. And that's why when we look at one of the formula earlier for treating pulmonary fibrosis, the Yi Qi Xuan Bi, the formula that treats the pulmonary fibrosis in which huangqi is used at 30 to 60 grams, that is exactly the same reason here, right? So at low doses, it helps to stimulate the production of the white blood cells. But at large doses, it becomes, well, at low doses, it's an immunostimulant herb. At higher doses, it becomes an immunoregulatory herb. And it helps to modulate and push down the pro-inflammatory cytokines. And at the same time, it helps to alleviate the apoptosis and necrosis of the renal cells. So basically, it relieves the death and hardening of the kidney cells, and also relieve the fibrosis by stopping the death cascade. All right. So if you are able to reduce the inflammation, if you're able to stop the autoimmune process and help to stop the death of the renal cells, that is how and why huangqi is so helpful here. And a lot of time when renal impairment and renal dysfunction occurs is as a result of some type of autoimmune disease or excessive immune response that end up damaging different parts of the organs. So if that's the case, then huangqi becomes a very valuable herb, not only for the renal impairment, but also for the pulmonary fibrosis. All right, so that's one of the herb. And then, for the more straightforward part of renal impairment where the kidney cannot properly excrete the fluid and the patient ends up with edema and fluid retention. These are many of the herbs that help to treat kidney dysfunction or renal dysfunction by treating the symptom and also addressing the cause. The symptom will be the water accumulation. So you can use 五苓散, 五皮饮, or 鳖蟹分清饮. Or if you want to go one step further, to use herb to tonify the kidney, specifically to nourish the kidney yin to help to restore the form. Okay, so then you can use 六味地黄丸, the 6-ingredient pill with Romania. So that would be the best choice. But if there's also yang deficiency, then you can use 金匮肾气丸 and also 自白地黄丸. 金匮肾气丸 is for kidney yin and yang deficiency. 自白地黄丸 is good for kidney yin deficiency along with deficiency heat. So deficiency heat in this case would be the chronic low-grade inflammation that is constantly present. Okay, and then the chronic inflammation is then damaging the kidney, is causing damage to the cells and tissue or the organs. So this last one is a formula that both restores the form, but also helps to clear the chronic inflammation. All right, the last one here is neurological disorders. This is the one that I find TCM practitioner tend to struggle a little bit more compared to the other 7 that we mentioned so far. And I think maybe the reason is that brain was not described as one of the Zangfu organ in the past. Okay, and also 2 of the most common long COVID complaints, or in fact 3, which is anosmia, ageusia, and also brain fog, are generally not described in TCM terminology. So of the calls and email that I still get these days, of practitioners wondering how to best treat long COVID, this tends to be the one that I get the most in terms of questions. All right, so anosmia and ageusia basically is a loss or impairment of smell and taste. Okay, and this is actually quite common. It occurs in about 13% of the patients with total loss and 44% of the patients with partial loss. So it's almost up to half of the patients with long COVID tend to have some alteration of loss of smell or loss of taste. So what happened is, a lot of us as TCM practitioner, like I mentioned, we don't ever, at least I don't, see the description of this in TCM literature, both historical and also today. So in a way, we become like deer in front of headlights. Oh my God, I've never seen this before. How do I treat it? So whenever you come across conditions like this, whether it's symptom or whether it's Western diagnosis, I think the first thing to do is to just relax and go back to our roots, go back to how we learn TCM, go back to anatomy and physiology, and try to understand how this occurred and how TCM would look at this. And then if you do it one step at a time, then it becomes pretty obvious what it is. So in this specific case, what happened is with coronavirus. Coronavirus gets into the body and attack different systems of the body by attaching themselves to the ACE2 receptors. And that's how they get into the cells and consequently damage the cells. And what happened is the nerves do not contain ACE2 receptors. So what happened is coronavirus really doesn't attack the nerve directly, whether it's the taste or smell or other parts of the body. So this is basically what the structure looks like in your nose and also in your mouth. These little nerves, let me see if I can get a pen to work. Drawing. Oh, here we go. Okay, so this here is basically your nerve ending. So what happened is this here is a nerve. Okay, these do not have ACE2 receptors. So the coronavirus cannot attack them directly. So it's not the nerves that are directly affected, but rather the cells that are right next to the nerves, they do have ACE2 receptors. So then what happened is the coronavirus attack to the cells surrounding or next to the nerve that cause either direct cytotoxic damage or cause inflammation to the tissue surrounding it. So now with the inflammation, they start to expand and they crowd and damage, affect the nerve in that sense. All right, so the nerves that are then affected will then cause interference to the function of smell and also function of taste. All right, so in the early stages, what you need to do is you need to treat the viral infection. In the early and mid stages, if there's a lot of inflammation, then what you need to do is treat the inflammation. If you can get rid of the virus, if you can reduce the inflammation, then the nerve will once again be able to function. And the effect to the smell and to the taste will then go away. Okay, so if you approach it from that perspective, then you should get very good result in terms of treating both effect to the taste and function. Okay, so now I'm trying to get out of the pen and get back to moving the slides. So hold on just a second, okay? Here we go. Right. So anyways, like we mentioned, once you understand that the virus does not directly attack the nerve, but rather it causes inflammation and then subsequently cause damage to the nerve, then what you need to do is in the early stage, treat the virus infection. So once again, you can use any of the antiviral herbs, or you can use this formula called 普剂消毒饮. And 普剂消毒饮 is a great formula to treat infection, specifically viral infection in the head area. Okay, if the inflammation is gone, so these are now long COVID patients that suffer from long COVID signs and symptoms, which is once again loss of taste and smell. You can then use herbs that help to open up the stagnation and open the sensory orifice. All right, so Xinisa magnolia flower powder is a good formula that's relatively mild to moderate at best, generally for allergy-related congestion to the nose. If it's more severe, where there's a lot of damp and phlegm or dampy, then 苍耳紫散 Zentium powder is a more powerful and suitable formula to use. And same with 青鼻汤 clear the nose decoction. Both of these are stronger, so formula that are more in line for treating sinus infection or dampy in the sinus cavity. And lastly, if it gets to phlegm accumulation and fibrosis or blood stasis, then you might need to use 通窍活血汤. So this is basically bordering along the line of irreversible damage. All right, so this is something that you want to treat as early and aggressively as you can, starting with acute COVID, starting with right afterwards, because the longer you wait, the more severe the damage will become and more difficult it is to reverse the damage. All right, so once again, starting from antiviral formula, 普剂消毒饮, to formula that help to reduce inflammation and restore the normal function, and that will be 辛夷散 苍耳紫散 and 青鼻汤. And lastly is if there is fibrosis, if there is long-term damage in the forms of perhaps fibrosis, then you can use 通窍活血汤. Okay, another very common complaint among patients is brain fog. Basically, they use this term to describe slow, sluggish thinking in post-COVID cases. And in this case, what happened is the patient can clearly experience it, even though they may not be able to clearly describe it. So the best way is that their body feels fine, they're not tired, they're not fatigued, but just somehow it feels like their brain is not very clear, okay? And the percentage of patients that suffer from this is about 22 to 32%, okay? So once again, it's quite high. And once again, there is no such term as brain fog in TCM literature. So once again, you have to think, well, how would TCM see this? Or what is the physiology that occurs behind this? So once we understand the physiology, perhaps we can understand better how to treat it. So once again, in the laboratory finding, we know that the virus is not in the brain, okay? And also virus does not attack, the nervous system does not have an ACE2 receptor. So the virus cannot directly attack the nerve cells, but rather is most likely the virus that attack the blood-brain barrier or the surrounding tissues that cause acute and chronic inflammation, as well as blood vessel damage that then affect the blood functions. So to properly treat this, once again, think of inflammation as heat and blood vessel damage possibly as blood clot. Okay, so you need to treat the virus if there is still infection. You need to use heat clearing herb to treat the inflammation if there is heat. You need to use blood moving herb if there's blood vessel damage. And then lastly, one formula specifically that has been used for in this case is called 益气聪明汤, which is augment qi and improve acuity decoction. Okay, so this is a formula that's used historically for the elderly patients, but today also for young patients to improve the mental function. And I mentioned historically for elderly patients is mainly because as we age, obviously we have more forgetfulness, we have more mental decline. So this is historically used for that purpose. It's also used quite a bit for children, or not necessarily children to adolescents. And the reason is because in Asia, there is a tremendous amount of academic pressure on the kids to do well in elementary school so they can take the exam to get into the best middle school. They can then take the exam at that time to get into the best high school. And then upon graduation from high school to take another entrance exam to get to the best college. And what college they go to, in a way, dictates what job they're going to get and how successful they're going to become. So there is a tremendous amount of academic pressure since elementary school for kids to do well. Okay, so then what happened is a lot of the herb companies in Asia then use this formula and sell this formula on a retail basis to get the parents to buy this formula to give it to their children so they can do better in school. Okay, so this is what the classic formula was originally used for, but how it's also evolved commercially today for patients. And as far as brain fog, this would be a great formula to use. But once again, make sure the virus has already been cleared and make sure there's not heat in the form of inflammation, especially autoimmune. Otherwise, you may need to modify Zenshen once again and perhaps use Dangzhen or Xiyangzhen instead. Okay, and then this article also mentions additional things you can do, such as acupuncture points, how the patient can do acupressure and massage themselves, and also ear seats. Okay, so these are many other options that you and the patient can use, both in treatment and also at home. Okay, and finally, rehab is also very important. Patients should engage in proper exercise to help with the mental and also physical recovery. I would say, especially in the beginning, try not to engage in any exercise that requires balance or has higher risk of injury if they accidentally fall. You know, and that's why in the beginning, Tai Chi Quan and also Ba Duan Jin, the 8 brocade, are probably two of the better exercise to do. Okay, and believe it or not, there are also research that have been done for both of these exercises. Okay, so I won't go into the detail, but this is an article that talk about different exercise you can do and also different at home acupuncture things you can do. Okay, so this is Ba Duan Jin. Ba Duan Jin is not as common, but I think it's an excellent exercise in this case, mainly because you do most of this in a stand-up manner. You don't have to move around too much, and you don't have to have great balance. So for elderly patients or patients that have dizziness or lightheadedness or even vertigo, this is a very safe exercise to do. And these are some of the acupressure points. All right. So overall, Zhang Boli is one of the key figures in China as far as leading the treatment for COVID-19. And overall, he mentioned that we need to address both physical and physiological concerns. We need to focus on not just the lung and the spleen and stomach, but many other organs in order to treat the person as a whole, not just the disease. And then finally, it may take up to 1 year for full recovery. All right, so the disease, a viral infection itself may be a 1 or 2 week thing, but long COVID, in some cases, may be much, much longer. Okay. And lastly, as I wrap up, if there's any blessing in the disguise, I remember when I first graduated from acupuncture school and also pharmacy school, there were basically 0 peer-reviewed journals that are available online as far as TCM goes. And fast forward about 25, 30 years, as I do these research related to COVID-19, if you go to pubmed.gov and just type in COVID-19 and traditional Chinese medicine, well, guess what? there are 1,866 articles just on this topic. So we have come a long way. These are articles that are peer reviewed and published in medical database. Okay, so for those of you who are interested in learning more from a scientific perspective, there is a tremendous amount of information to learn from. And I think we can advance the medicine the best if we combine both the traditional knowledge of TCM and also the more contemporary Western and pharmacological information knowledge of TCM. Because I think two sides definitely have a lot of pros to offer for us and also for the patients. And then lastly, during this last 2 years, I was very actively involved with UCLA and also UCSD in putting together a clinical trial. They started about 2 years ago, and they're hoping to completely wrap it up by the end of this year. So I won't get into the details because this is really their study, and I will leave it to them to publish the final results and give final presentation. And in fact, if you are going to Pacific Symposium this year, one of the chief researchers will be doing a presentation basically throughout the day. I will just share with you one thing that's quite exciting. This is actually an article that was published in JAMA, which is Journal of American Medical Association. And then Thomas and I were both involved in this. I contacted Thomas because they wanted some visual aids, of all the herbs that were used in Qingfei Paidu Tang. So Thomas was kind enough to gather all the herb and take a nice photo on a very short notice. So what you see on here are the herb samples from Kamwo. Okay, and they also got some information from me as well because they wanted to know how Chinese herbs work. And initially, the chief researcher gave them terms such as yin and yang, long heat, and so on. And the authors just started to roll their eyes. Oh, we don't understand this. This is not going to go well with the JAMA audience. So we then elaborated and basically give them descriptions of the herb that they can understand, such as Ma Huang can treat asthma by dilating the lung. And then Sigao has antipyretic effect to lower the fever, and Gancao has anti-inflammatory effect to reduce inflammation and so on. So this is an example of where it's very helpful to know Chinese herb from a TCM perspective, but at the same time, knowing how it works to explain it to your peers so they can understand. All right. So that concludes my presentation. I ran quite a bit long, but I'll stay for at least 10-15 minutes to answer whatever questions you have. Okay. And lastly, these are on the website. So whatever additional information you're looking for, you can click on those links at eLotus, and it will take you to whatever information you need.
Okay, great. Thank you so much, Dr. Chen. And I certainly learned a lot. I'm sure many of us in the group also feel the same way. So thank you for coming. And so you guys have questions for Dr. Chen? If you can just raise your hand on the, let's see if you can do that. If you can raise your hand and then we'll call on you to unmute. Okay. All right, we don't, oh, we have one. Here you go. Let's see. That is okay. All right. That's Larico. Can you unmute?
Yes, hi. Thank you very much, Dr. Chen and Tom, for doing this. Dr. Chen, I've been following you since before COVID, but especially with COVID, and you were so pivotal in helping me understand how to treat COVID and now long COVID. I had a quick question. If you can explain the mechanism of Shachai Hutang and how often I hear that it can elevate liver enzymes, but yet it's good for liver conditions. Would you be able to expand a little bit more on that?
Well, like I mentioned earlier, right? So what happened is Shachai Hutang is one of those formulas that do a lot of things. But I would say primarily if you have to think of one thing that it does, that is, it helps the body to help itself. It's more of a regulatory formula. So it doesn't stimulate the immune system or it doesn't suppress the immune system, but rather it regulates the immune system, okay? And as far as the liver is concerned, I would say the overwhelming evidence is that it helps the liver to lower the liver enzymes and all the indicators. Okay, so for that reason, that's why it's one of the best herbs to use for patients with hepatitis, with liver fibrosis, and so on. However, there's one main caution that we need to keep in mind, and that is a lot of these patients, if they already have hepatitis, they may be treated with interferon in Western medicine. Okay, so interferon is one of the pro-inflammatory cytokines, and what they are trying to do is use interferon to direct the body to kill the virus. Okay, but in that case, what they have found in Japan is that if they also give these same patients Xiao Cai Hu Tang at the same time, and you have to remember, once again, Xiao Cai Hu Tang has ginseng as one of the herbs, and ginseng has a strong immune stimulant effect. So now what happened is you have interferon that's already there, and drug, they just continue to give the same drug at the same dose. What happened is you may now, in fact, cause too much heat from a TCM perspective or cause too much inflammation from a TCM perspective. So now what they found is a combination of interferon and Xiao Cai Hu Tang, probably more specifically ginseng, then increase the risk of pneumonitis in these patients, which is hardening of the lung tissues in the patient. All right, so this then becomes a black box warning in Japan that patients that have hepatitis can be treated with Western medicine with interferon or with Chinese medicine with Xiao Cai Hu Tang, but not both at the same time. And this is why I mentioned earlier, if the patient has still heat, then don't use ginseng because ginseng is hot. If the patient shows has pro-inflammatory indicator, has autoimmune disease, then you don't want to use ginseng because it's an immune stimulant. Okay, so whether you ration it from a TCM sign and symptom perspective or Western pharmacology perspective, once again, you will in the end reach the same conclusion.
So if they're not on interferon, but if they obviously have autoimmune or heat signs, you can use Shai Chai Hu Tang, just don't use Ren Shen.
In that case, it would be best to take it out. And that's also the reason if you look at in China, when they put together Qing Fei Pai Du Tang, they also modified Xiao Cai Hu Tang and they took out ginseng as well. Okay, so in other words, when the patient have acute condition with infection, with inflammation, then ginseng is not needed because your immune system is already activated. It's when they strictly have the Xiaoyang syndrome, okay, where it's in between, the immune system is subsided or is slightly confused, then in that case, ginseng is fine.
Thank you very much.
Sure.
Okay, great. Thank you. Thank you for that question. So we have Bill. You can unmute.
Hi, John. Great,
Hi, Bill.
great presentation. I have a two-part question, if that's okay.
Sure.
You mentioned the Yiqi Congming Tang, and I'm wondering why it has Huang Bai in it. And the other part is, I haven't seen many Ma Huang indications with Omicron. Do you think that'll affect the clinical trial?
Huang Qin most likely is used to clear the deficiency heat. Okay, it's actually a formula that I don't study a lot because just the need just hasn't come up very much. Okay, but the primary effect is to tonify qi and increase blood circulation to the brain. If the patient shows any kind of deficiency heat, that's why Huang Qin is there. But if not, then obviously you can take out. On a side note, Yiqi Congming Tang is a classic formula, but commercially may or may not be available in the US. Okay, so if it's something you want to get, then obviously just put it together yourself, either with bulk herb or herbal extract or any other form that you know. And what was the second part? Sorry.
The I used a lot of Ma Huang formulas with the original COVID, but since Omicron, it's pretty rare they require Ma Huang. Do you think that's going to affect the clinical trial of Qing Fei Bai Du Tang?
Qing Fei Bai Du Tang actually just, I would say probably not. Okay. I think Qing Fei Bai Du Tang is made as a large umbrella or large net that is trying to cover all different manifestations of COVID-19. Okay, so different patients will show different signs and symptoms. And different variations of virus, different mutations will probably show different signs and symptoms. With Omicron, the signs and symptoms are milder. So I don't think the use of Ma Huang will lower the effect of the formula. It's just probably not necessary.
Thank you.
Mhm.
Okay, great. Thank you for your question. Let's move on to Antoinette DeLeon. If you can please unmute yourself.
Hello, Dr. Chen. So I am wondering two questions. One about Ma Huang that you guys were discussing. I believe that we're not allowed to use it in California. And I was just wondering if something had changed, if we're allowed to, or what people are doing about that.
That is actually a very long question to get to the answer. Okay, but the short answer is FDA specifically said that they do not consider anything with ephedrine alkaloid as dietary supplement or as food, but they also left a backdoor that says, but that's not how traditional Chinese medicine is usually practiced. So, and basically that's it. So basically the kind of don't ask, don't tell is that if you have a vendor that is able to import Ma Huang and meet all the FDA requirements, and you as a TCM practitioner uses it with caution, but only under the traditional description, then there are cases where the use is allowed.
Oh, okay, wonderful. Thank you.
Okay, yeah.
Second question, I don't know if this is a silly question. I know that for prescribing the formulas for how many days a patient would take it depends on the symptoms and the patient, but I was wondering if there's a rule of thumb in regards to some of these formulas, or like an average. When you prescribe a formula, should they take it for 3 days, 7 days, and then reassess, or what?
Well, I think a general rule of thumb when you're treating the infection is you want to make sure you take the herbs long enough that the infection is completely treated. Okay, and this could be true for both bacteria and virus because you want to make sure they are completely eradicated so you don't end up with bacteria or virus that end up mutating themselves because they are not completely killed. And what that means is you take the herb until all the signs and symptoms are gone. And then from that point on, maybe 2 or 3 days more. And realistically, that usually means somewhere around 7 to 10 or 7 to 14 days.
Thank you.
Okay, great. Thank you. I just want to chime in real quick on the Ma Huang issue. Just want to know. So at Kamwo, we do have Ma Huang, and we did get audited by the FDA, and it is absolutely okay as long as we are practitioners, licensed practitioners. Just want everyone to know that. So we're not doing anything in the dark. It's out in the open. As long as you're a licensed practitioner, that's fine.
Okay. Yeah, one other, if you happen to be attending Pacific Symposium, Lan Kao is one of the chief investigator, and she will be doing presentation on the Qingfei Paidu Tang presentation. And I do know they have to jump through a lot of hoops in order to get Ma Huang imported. And the two main hoops are FDA and also DEA, because ephedrine alkaloids can be a raw material to make amphetamine. So they want to know exactly who is importing it, who is using it, and that basically does not get abused either into a street drugs or used as a supplement for weight loss.
Okay, great. Let's move on to Pragna. If you can unmute yourself.
Thank you. Thank you so much, Dr. Chen, for all you do for our field.
Oh, you guys are very welcome.
So I've been treating a lot of long COVID patients with herbs and acupuncture. It's been going really well. I have one patient who has severe autoimmune disease and had a kidney transplant when he was young. So he's on prednisone and other immune suppressants and blood thinners. And so I'm just doing acupuncture for him a couple times a week. He's doing great. But what's your opinion on use of Chinese herbs with people on this kind of medications?
Okay. Like I mentioned earlier, I did not have a chance to get into COVID vaccine and possibly that being a trigger for autoimmune disease. And the reason is because autoimmune disease is a 8-hour lecture. And in fact, I did one a few years ago on treatment of autoimmune disease with TCM. So without getting into the detail, I'll give you kind of the 1-minute version. Okay. So what happened is there's usually a trigger that causes the immune system to become hyperactive. And that trigger can be a chemical, can be a toxin, can be an allergen, can be a virus, can be a lot of different things. And as that trigger or that chemical is accumulated in the body, the immune system is stimulated and is overstimulated and to a point where it gets confused. So in addition to targeting and eradicating that trigger, it starts to attack normal healthy tissues in the body. And then those tissues gets attacked, they get damaged. So initially the organ will then lose the function and eventually the organ will be damaged. And that at that point, it becomes a irreversible disease. All right, so from a TCM perspective, one of the first things you want to do is try as best you can to identify what the initial trigger is and avoid it if at all possible. And sometimes it may not be possible because it's already there, but avoid it if at all possible. And then think of the hyperactive immune system as the systemic heat and fire in TCM. So you need to use herb that clear the systemic liver and fire all throughout the body. And then you also have localized heat and fire. So if the immune system is attacking the thyroid gland, the skin, the eye, salivary glands or tear glands or whatever the organ is, then there is that local heat. Okay, so you might need to use heat to both suppress the immune system and also to clear the inflammation. Okay, and then like I mentioned, function will be the first thing that's affected, and form is later become damaged. So function is usually represented by qi and yang, and form is usually represented by yin. Okay, so initially you might need to use some qi tonics, but be careful not to use qi tonic that are immune stimulants to restore the function. And later on, if the organ is damaged, you need to use herbs to nourish yin. And it's primarily kidney yin, but it also could be lung yin or stomach yin, once again, depending on what part of the body that's affected. And then at the same time, so basically, there is not a one-size-fits-all as far as treatment of autoimmune disease is considered. It depends on what stage, okay, and how severe and where in the body. So as far as autoimmune disease goes, Wen Bing Lun, warm disease theory is a lot more applicable than Sang Han Lun, the cold disease. So basically you have Wei, Qi, Ying, Xue, right? And those are the different stages. So as the disease goes from exterior to interior, it's mostly heat and fire. It's damaging the yin and so on. You pick and choose what formula is best for that particular patient. And in the end, it's a balance of clearing heat and nourishing yin and how to best walk that tightrope.
Thank you. What about the patients on prednisone, blood thinners, other immune suppressants? What would you do with them?
Okay, prednisone, I wouldn't worry too much. Prednisone, think of it just as an excessive amount of internal production of the steroids. Obviously, if you use a formula with a large dose of ganzao licorice, licorice does stimulate the internal production of the steroids. That would be a concern. But generally, we use ganzao in Chinese medicine in a small amount as a harmonizing herb. So it's a theoretical concern more than a clinical concern, okay? If the patient is using immune stimulants, then once again, it's a tightrope that the patient has to walk. If they use too much of the immune suppressant drug, then what happens is they are going to be catching a lot of infections, and obviously that's not healthy for them. And the patient at that time may appear to be qi deficient or wei qi deficient. Well, you can use qi tonics, but at the same time, you have to be very cautious. If you use qi tonics, let's say you use some Rensen or Huang Qi because they're getting too many infections, then what may happen is they may get back to just the right amount of immunity, and that's great. But if they respond too well or the dose is too high, then you may end up seeing a immune flare-up. Then obviously that's not good. So immune flare-up could be too much heat and fire. Okay, so that's what you have to consider, and that might be a very difficult tightrope to walk, because if it works well, great. If it works not well and the patient have complications, well, then I'm sure you know who's going to get blamed as far as that goes. And same with anticoagulant and antiplatelet. If the patient is on any kind of anticoagulant, antiplatelet, you need to be very careful with blood-moving herbs. Most of the classic interactions are documented between Coumadin and Chinese herbs, namely Dangui and Dansen. Dangui is Angelica sinensis, and Dansen is salvia. Okay, so if you search for literature, that's what most examples will be. And then the question will be, well, what if there are other newer anticoagulant or antiplatelet? What if you use other herbs, whether it's Taozen or Honghua or others? Well, then I would say, based on the theory, you still have risk of interaction. So once again, you have to be very cautious. Okay, so if the drug is already doing the job, then you probably don't need to prescribe herbs. If the patient is not taking drugs, but they show indications of blood stasis, then I think it's fine to use the herb. Then obviously the difficulty is if the patient is using drugs, but they still show indication of blood stasis. Do you use herbs or do you not use herbs? If you ever get into that conundrum, I would say before you do, make sure you know the drugs and the herb very, very well. Make sure you communicate with the patient and the medical doctor of what you're trying to do, so everybody's on the same page. So worst case scenario, if you do prescribe herbs that move the blood and the patient is on some kind of antiplatelet, anticoagulant, and they start to show more bleeding and bruising, nobody is surprised, and we know what to do. You either need to take away the herb or reduce the dosage of the herb or drug, or if necessary, do the opposite, which is to introduce drug or herbs that stop bleeding. Okay, but once again, the unfortunate fact is that in today's environment, if something goes wrong, usually the herb gets blamed or TCM practitioner gets blamed. So it doesn't hurt to be a little bit extra cautious.
Thank you.
Great, thank you. John, do we have time for one more? I know we're over.
Sure. Well, let's do one more and then we'll get going.
Okay, great, thank you. This is Alyssa?
Yes, hi, how are you? Thanks, Tom, and thank you, Dr. Chen. I actually have two questions, if that's okay. If someone has a mild case of COVID, do you recommend that we still give herbs? Like, for example, I just had COVID, and it was pretty mild, so I was kind of tired and I just didn't even bother giving myself herbs. But do you think it's better to just go ahead and take something like Inchaosan or?
Personally, I do, because even if it's mild to moderate type of COVID, if you take herbs, basically you will get over it faster. Your signs and symptoms will be much more mild, and then hopefully you will also have less chance of having long COVID. So when I have it, when all my friends and family and patients have it, yeah, we give them herbs. I give them herbs.
Okay, and if someone is taking Paxlovid, do you recommend that they just take that and don't need herbs, or should we make an effort?
Well, then it depends on what you want to be. Do you want to be a primary healthcare practitioner, or do you want to be a complementary healthcare practitioner? And what I mean by that is the first thing that you discuss with the patient is, well, how are you doing with the drugs? And not this drug in particular, but I think in all cases, basically follow the same rationale. If they are doing fine with the drug, it's doing what it's supposed to do, they don't have any side effect, they don't have any complaints, then I'll just let it be, okay? If they are doing fine, okay, but there are some nagging side effects, but they have to stay on the drug, then I will consider using herbs to try to treat the side effect as long as it doesn't affect the main drug. Okay, or last case scenario is if the patient is taking a drug that's not working and they also have a lot of side effects. And then what I would consider doing is show the patient, perhaps a copy of PDR, so they know what drug they are taking and all the side effects. So they understand that the side effects are directly related to the drugs. And then let them come to a conclusion or discuss with their physician as far as whether they want to continue the drug. And I think that's very important because Western medicine or use of drug is not within our scope of practice. You don't want to be the person that tell the patient, oh, this drug is not working, stop using it. Because if you do, and they stop it, and there's a rebound condition or the disease condition, then you could be liable for that. All right, so you always want the patient to discuss it with their physician or decide to make that decision on their own, but it's not you that talk them into it. Okay, so and then whatever the disease is, then you look at it from a TCM perspective. You come to your TCM diagnosis, then you treat it that way. Okay, so you can just support the patient as a cheerleader as they take drugs for whatever purpose it is. You can be a complementary practitioner and you treat the patient using herbs to treat the side effect of the drugs, or you can be a primary healthcare practitioner and just treat the patient using TCM by itself.
Okay, thank you.
Mm-hmm.
Okay, great. All right. I think that'll wrap it up. Thank you so much. On behalf of the group again, thank you, Dr. Chen, for your being so generous with your time. And also, not just for tonight, but also just the good work that you do on behalf of the profession.
Okay.
Grateful.
Yeah, and
Thank
then
you.
if there's any thing that's not clear, if you have any questions that I did not get to, feel free to send Thomas an email or send me an email. I'll be happy to talk with you online or in person.
Yeah, okay.
All right. Thank
Great,
you very much.
All right. Good night, everyone.
Okay, good night. Bye-bye.
Bye-bye.